This video is going to discuss how we teach or review goals and outcomes with our students this week. I'm always going to refer to the PowerPoint presentation that Dee Dee gave them on the nursing process. I did send this to you a couple of weeks ago, so if you need to go back and look at how, if your students are having trouble with writing nursing diagnoses and things like that, it is in the first couple of slides of this. So, but we're starting here on planning, and we're going to talk about identifying our goal. That's what we do first. Basically, so if you have if you've prioritized your nursing diagnoses and the nursing diagnosis is acute pain, obviously we're identifying that if that's our priority nursing diagnosis, that we want to decrease that patient's pain. Second, identify how you will measure these goals. These are called your outcomes, and identify interventions, which is not where we're going this week, okay? So you can refer to this slide as well. You can print these off if you want to, guys. It's however you prefer to teach it. So the first part, there's the nursing diagnosis that they've already done. Now we're going to go write a goal. And so I know that every college may teach it a little different. We write ours as a goal outcome statement, and it's a two-part statement. So the first part, the goal part, is going to basically go along exactly with that priority nursing diagnosis. So we'll talk about, I have an example that I'm going to bring up. So once you have your goal in mind, ask yourself, how will I know the patient has achieved that goal? And these are the outcomes. And that should be very specific and measurable, and should also have a time frame. Here's some examples. So if our goal is the patient will have improved mobility, okay, that is the goal. This is an outcome, as evidenced by the ability to raise his right arm above his head by discharge. So we have a measure here. We are raising our arm above our head. I don't know if I said that right. Our arm above our head, and a time frame would be by discharge. So of course, the nursing diagnosis for this was probably that the patient had impaired physical mobility. But here's another one. The patient will have an adequate cardiac output. So if the patient's nursing diagnosis had been decreased cardiac output, this is our goal, and we measure that by a systolic blood pressure greater than 100 millimeters of mercury by 1600 on 2/3/15, whatever the date is. So again, we're showing this is the goal part, and this is the outcome part of the statement. So let's look at what that actually looks like, okay? Let's see here. Go down, make sure I didn't forget. Okay. As we're talking to them about outcome, they do have a pretty hard time in the beginning with this, and I can understand why. So we want them to state their goal. Their goal is going to be very vague, okay? So I always teach my students that a goal starts with patient will, okay? So the patient will what? And that's going to be going to depend on what that nursing diagnosis is. So if our nursing diagnosis was acute pain, patient will verbalize a decrease in pain is my goal. And I'm going to measure those. I'm going to measure that with my outcomes. They're going to be safe, effective, patient-centered, timely, efficient, and equatable. Here are errors, expression patient outcomes as a nursing intervention. That's why I have them start as patient will, so they don't do a nursing intervention. Use verbs that are not observable or measurable, like will have, or they don't use an action verb in there. An action verb, we're wanting to demonstrate, to verbalize. Those are all action verbs. And writing vague evidence by statements. So they don't really have a measure in there. Or unrealistic. A very common one when we're talking about the patient will verbalize a decrease in pain or demonstrate a decrease in pain. They always say by not, one of their measurable outcomes is by not asking for pain medication. Well, depending on what you've had done, like if you've had a knee replacement, that's not realistic. So we're going to talk to them about that in post-conference. So here's some examples, some incorrect. The patient will have, see, that is not a, I guess it is, but the patient will have improved gas exchange as evidenced by using the incentive parameter every 2 hours. It should say the patient will have improved gas exchange as evidenced by reaching 1,000 milliliters on an incentive spirometer by noon. Just by using it, that's not really measurable. So we need to say the measure here. The patient will have less pain. I don't personally care for will have, but that's fine, as evidenced by complaining less. That's not a measurable outcome. What is less? The correct is the patient will have less pain as evidenced by rating their pain 3 or less while hospitalized. Incorrect, patient will understand medication use as evidenced by learning the side effects of Percocet by discharge. That's not measurable. So the correct would be patient will understand medication use as evidenced by being able to state frequency and dose and 3 common side effects. It's just very specific, okay? Let's go down here, sorry. Okay, and that's where we're stopping. So I did make a little case study for you to read out loud to them. Please know that this case study is not in depth. I of course didn't put in a ton of stuff. You can add to it, you cannot use it. It's completely up to you. So our patient is a 57-year-old male. He was admitted yesterday for a left total knee arthroplasty. He has a history of osteoarthritis, hypercholesterolemia, carpal tunnel, and gout. He has no known drug allergies. He had carpal tunnel release surgery in 2011 and a hernia repair in 2013. His vital signs have been within normal range, but his pain has been difficult to manage. He has Percocet ordered every 4 hours PRN, and he has needed that routinely. He has ice offered to affected extremity continuously for the first 48 hours. He has PT ordered BID, but he has not been able to ambulate due to his pain. He has set up in a chair at bedside. That's the only activity he's done. He is voiding freely but has not had a bowel movement. He has hypoactive bowel sounds ×4 and has a daily bowel regimen, medication ordered. He has a regular diet ordered but has not eaten much due to his pain. He is very anxious about planned discharge tomorrow due to living alone. He is afraid that he will not be able to care for himself. So obviously there's so much more that could go into a report than that, but I'm just trying to help guide these students. So here is the example that I'm giving you. I wasn't able to do a video last week, so just briefly wanted to explain. They're going to take the information from this or from the information they have gathered by looking up their patient in the computer, and they're going to write nursing diagnoses under the heading that they think it fits. So looking at this patient, the information I know, I did not have any neurological cardiovascular, yes, he has a history of hypercholesterolemia, but at this point, they're not going to put anything there. And there's nothing respiratory-wise there. Gastrointestinal, decreased GI motility related to anesthesia during surgery, scheduled opioid medication, and decreased mobility. And then the data is information that they have gathered on their patient that supports this nursing diagnosis. So the patient states that he's had a bowel movement, had a bowel movement since before admission. He has decreased bowel sounds in all 4 quadrants. In his bowel regimen ordered is Colace 100 milligrams BID, Synacot 17.2 milligrams BID, and Miralax. You notice here that this is very specific. I don't want them just writing Colace, Synacot, and Miralax. This needs to be patient specific. Musculoskeletal, he does have acute pain related to tissue trauma at the surgery site, and that is the patient rates his pain a 7 out of 10. I think I put that in the thing. If not, you can add it there. Percocet 5 milligrams. See, there's actual order, and he's grimacing with movement. Here is education down here, and he has anxiety. Okay, so this is kind of what we would want their first page to look like. I do encourage you, if you like this case study, to read it out loud and let them, go through this with you, okay? See what they come up with, because of course this is not inclusive. There could be a lot more there. Okay, so they have prioritized their nursing diagnosis. I think we would all agree that pain is his #1 priority nursing diagnosis, so acute pain related to tissue trauma at surgery site. So we know that we're wanting to decrease his pain. So they will rewrite their primary priority nursing diagnosis here. Okay, and so that goal should basically mimic this priority nursing diagnosis. So if the patient has acute pain, our goal is that patient will verbalize a decrease in pain, or patient will have a decrease in pain. That is the first part of the statement, as evidenced by. And here comes your outcomes, which are specific and measurable and should have a time frame. Verbalizing a pain level of 4 or less on a scale of 1 to 10 by the end of my shift. So they can put the date there, or as long as it has a time frame. Ambulate down the hall 2 times during my shift. So remember, because he wasn't doing that before. Verbalize need for ice to be applied to surgical site for pain and inflammation management. Ooh, but there's nothing there. So that needs to say by the end of my shift. Okay? And save that. And that's where we're stopping. So what I'd like for you to do is, after you run through this little case scenario, have them state their priority nursing diagnosis. Get a couple of people to actively engage in this. And so let them start using their actual patient they've cared for and let them go through this. I really do think if we spend enough time in post-conference and help them, we're not going to do it for them. I'm not going to sit there and just write down nursing diagnoses in the data that they have and write their goal outcome statements, because I want to hear from them, but we're going to have to pull it out of them the first couple of times, okay, because this is new to them. So help them to see it. And I think that our grading is going to be a lot easier if we're all actively doing this during post-conference. And I do think that because I'm going to try to have something like this for you every week, taking it, to the next step that we're going to be doing, so that you have a case study or an example to go by, and then to start talking with the students about their patients, and hopefully they can get a good bit of their concept map done while in post-conference. So I think it's a really good way for them to learn. So I hope this video helped. Please let me know if it did. If it didn't, I can work with you one-on-one, okay? Let me know how your students are doing with the paperwork, if we need to figure out a different way to teach it or something, okay? Y'all have a great rest of the weekend, and I look forward to hearing how this next week goes.